secondopinion.org. We want to thank you for tuning in, and we thank you for allowing us to join you at home this day to talk about magnesium. Magnesium is an important element, an important mineral for the human body that unfortunately in our society is often deficient and creates lots of problems. One of the first things I try to do is post up the best forms or good forms that you can purchase it in, knowing the best forms are there for a reason. They are the most highly absorbable, beneficial forms for you to get them in, but there are others that you can use depending on cost factors in your situation. Magnesium's best forms are glycinate, that is the best. Oxide is another good form, very excellent form. I consider those right across the line as best forms. Good forms, carbonate, chelate, citrate, malate, and aspartate. Okay, good forms. Okay, one of the other things I always try to make sure is clearly understanding the dirty secret about minerals. When purchasing magnesium, okay, you must first find out what the total amount of magnesium is in any capsule that you purchase. Here's the problem. If it says magnesium orotate and it says 100 milligrams, if it doesn't clearly say that the amount of magnesium is 100 milligrams, what you don't know is whether it's only got 5 milligrams, 1 milligram, or 10 milligram out of 100 milligrams, and the rest of it is orotate. In other words, the cheaper the nutrient, often they are sacrificing the expensive minerals to end up with fillers that you end up with, because bottom line is they don't have to put on their bottle a delineation of how much magnesium is in there. At Physicians Premium, every time that you see it listed on the bottle, that's the amount of the element we're giving you. If you look and it says 100 milligrams of magnesium, it means there's 100 milligrams of magnesium. Now the truth is, if it's magnesium oxide, let's say, which are frequent in our nutrients, okay, as well as glycinate. If you look at it and it says 100 milligrams of magnesium, okay, more than likely the secondary, there's probably 50 milligrams of the other filler stuff, but it's never even mentioned, or it's differentiated for you to see on the bottle. Why? Because then you know that you're supplementing the right amount for the right condition so that you don't underestimate the needs of the body. Minerals, why are they so important? And boy, are they important. Minerals are organic substances that are vital for your health and vital for your very life. The majority of minerals cannot be synthesized by the body, thus the diet or supplements must occur for your body to get the needed mineral on a consistent basis. Okay? In the vitamin sessions, if you've looked at any of those that we've produced, you'll find that the synthetic versus natural forms is not such a big issue when it comes to minerals. It plays some role, but it's so confusing, it's hard to explain, even for me, and I try to explain everything in a way that anyone could understand it. But what I know is, if you buy it in the best form that you can, you usually do pretty well with minerals, okay? The Synergist are those elements that should be included with the magnesium, and here they are. Calcium, phosphorus, which is plenty in your diet, you usually hardly ever need to supplement it. Potassium, vitamin B6, vitamin C, and vitamin D. Remember the whole tie-in, if you've looked at our calcium one with vitamin D, magnesium together are big elements. Well, all these other things need to be there if you're going to get the highest absorption of magnesium. So in a multiple vitamin, it's important. And if you want to take more magnesium beyond that, make sure it's taken at the same time you get a multiple vitamin or a multiple mineral in conjunction. I always post up broccoli for you to look at, simply because if you are eating poor quality diet and you're eating refined general foods and boxed and canned foods and giving your kids cereals that are enriched with certain nutrients because all the other ones have been leached out, let me tell you, you're really setting up your children and yourself for lots of health problems. Please realize when you're eating raw, unrefined, quality grains, vegetables, and fruits, you're doing wonders. And here's a good sign of all the things you're missing that I cannot make a supplement to accomplish all that. It's just impossible. It's inordinate. Apple, look at this. Look at all the elements that are in there. You aren't eating fruits and vegetables. I don't care if you like them. You don't like going to work. You don't like paying taxes. You don't like a lot of things. Same thing with fruits and vegetables. You not doing it sabotages and encourages ill health throughout your entire family. So get over it. Start doing what's best for you and your family, and not worry about, gee, I have this choice and I don't eat apples and I smoke and I drink. And you can do all that, but don't sabotage the rest of your family for your foolishness, okay? Hate to be candid about it, but it's important because you got to do something about this, folks. It's just too important. It's life-changing, okay? Conditions specifically that magnesium seems to help: fibromyalgia and chronic fatigue, angina, heart pain, okay? High blood pressure, oral contraceptives. Longer you're on the pill, more likelihood magnesium deficiencies will exist. Asthma, autism is benefited. Chemotherapy support, remember, got to have the doctor's support in that one. Congestive heart failure, osteoporosis, PMS, big deal with PMS, diabetes, glaucoma, high cholesterol, kidney stones, migraine headaches. If you remember seeing the calcium one, if you haven't, please do. You'll see a lot of these kind of coalesce together. Food sources: nuts, whole grains, beans that are unrefined, dark green leafy vegetables, fish, and quality meats, okay? Will many times have magnesium, but meats and stuff like that many times don't have that much of it, okay? Risk groups: people taking potassium depleting medications, usually for high blood pressure, okay? Majority of the U.S. public are low in magnesium, and that has been documented up to the point of 72%. Laxative takers shove magnesium out, and magnesium is a great laxative. Maybe that's what you should be using, okay? Alcoholism, severe burns, diabetes, heart failure, fatigue, depression, and muscle weakness, indicator of that risk group, okay? Toxicity, very unlikely, but diarrhea is one of your first signs. In kidney disease people, it's a possibility, again, not very often. Absorption is often blocked by other minerals, medications, and mineral oils that some of you take to keep your bowels clear. If you're taking it too often, you'll create a magnesium deficiency. Medications that will interact with magnesium. Osteoporosis medications, seems like it would be the opposite, right? Aluminum-based medications, okay? Those are a big issue. Sinus medications, cholesterol-lowering medications, cortisone, antacid medications mess up your absorption of many elements, just so you know. If you're on those medications to lower your stomach acid, you're going to create all kinds of other conditions over time. It's just what's going to happen. The longer you take it, the more problems you'll have if you're not careful. Anti-inflammatories, antivirals, anticoagulants, hydrocortisone, prednisone, sodium phosphates, and bicarbonates. Now, is that all of them? Absolutely not. There's lots more, but that's some of them we can mention. The USRDA, the recommended dose, remember, is to keep you alive, not to thrive. If you've not looked at Secrets of Vital Health, Secrets of Vital Health spells out what the RDAs really mean, and you should see that because it's kind of humorous. Plus, it gives you a pretty good picture of what to expect and maybe how to think about your supplementation levels. But men and women are at 400 milligrams per day on average, but that's not optimal for most people, not for me. Mine's more optimal around 1,000 to 1,200 milligrams, just so you know, because I carry muscle tension. It's a great muscle relaxant for me, okay? When we look at the Dr. Benzinger's advanced information, magnesium is so unique because it's an enzyme activator. Magnesium is responsible for over 300 enzymatic reactions. Bottom line is, if you're trying to get out of your house, but you don't have the enzyme to open the door, you don't get out of the house, right? Well, magnesium is that trigger to over 300 enzymatic reactions. So if you don't have enough magnesium, those things don't trigger, or don't trigger to the level they should. You're never going to get out of the house or do many things, okay? In other words, without magnesium in your body and at the right level, you compromise a large majority of your body's well-being and the activities it should be. This is a must supplement, as with calcium and a few others, okay? Fibromyalgia and muscle soreness, okay? Magnesium relaxes muscles after they have contracted, and if you do not have enough magnesium, you lose that relaxation factor, thus increasing tension and pain in the muscle on a constant basis. So magnesium, for those with fibromyalgia, muscle soreness, tender spots, magnesium is really important. You can dose pretty high on these areas too. Add B1 and a quality vitamin E that we cover in Secrets of Vital Health, as well as in the vitamin E seminar, have been shown to work together for this condition to reduce lots of discomfort, but you got to have the right stuff, not cheap products that don't work. heart conditions in our advanced information. High blood pressure has been helped effectively with the use of magnesium because it acts as a relaxant to the muscles in the arterial wall. So decreases resistance, thus lowers blood pressure. Heart patients on medications often are left with reduced magnesium and inducing and promoting arrhythmias and other problems in the heart. So talk to your doctor. You might not even know about it. And usually it's a safe one in combination with most medications, but you do need to check if you are on medications. PMS, premenstrual syndrome. Multiple studies have demonstrated the relationship with back pain, cramping during periods of magnesium deficiency, so something to look at. And I've commonly used this in temporarily large doses with B6 as well as with some calcium and had some really good success rates. Diabetes. It has been demonstrated in elderly patients with lower levels of magnesium. They also have lower levels of insulin, and supplementation seems to improve insulin production. Interesting enough. Add chromium, add magnesium, might be two good elements for you. Diabetes-induced eye disease is reduced if the person keeps their magnesium levels in good shape on a consistent basis. Okay, so that might be helpful too. And if it runs in your family, that's even more important. This deserves a special note. Dr. Pierre Delbert. Dr. Pierre Delbert is a French physician that really investigated magnesium chloride and found that it helped an inordinate amount of general conditions. Why? Probably because it affects over 300 enzymatic reactions. He spent years documenting its medicinal value in many forms and many conditions that ail the human being. And a special way of application of this product of magnesium chloride is that if you get magnesium oil, they call it, it's not really oil, it's actually a salt solution. What we know is it will absorb in the skin. If you can't get enough dosage in your mouth, that might be very, very helpful for you. Can sting a little bit if you have sensitive skin, I want to mention that. But magnesium chloride, not chlorine, magnesium chloride is a healthy option in magnesium. Okay? Dr. Benzinger's possible benefits of magnesium: fibromyalgia and chronic fatigue, angina, heart pain, high blood pressure, oral contraceptives as a protective, asthma, autism, chemotherapy support with their doctor's support, congestive heart failure, osteoporosis, PMS, diabetes, glaucoma, high cholesterol, kidney stones, and migraine headaches. Magnesium, important? How about like really important? Something that you really should be supplementing on a consistent basis unless you just happen to have that perfect diet, which most of us do not. This is Dr. Benzinger on Health with secondopinion.org. We want to thank you for tuning in. We'll look for you next time. Look us up at secondopinion.org or at Physicians Premium for information and life-saving information. Look for you next time, and may God bless you.